Welcome back to the Anderson Center for Hair. We're here with our patient Dan, and we're going to have a look at his stitches. It's time for the stitches to come out. We're at day 14 now, and have a look. You can see there's not a lot of evidence that really anything has taken place. Chin down for me a bit. It looks like in the back of an old person's head. You don't look like you've had an operation, but if we have a check under here, you can see right there are the stitches, and they are ready to come out. You see the hair's grown a little bit. We try to minimize the amount of trimming of the hair, so there's just a little bit left above and below the stitches. And we're going to take those stitches out right now. Let's have a look at Dan's scalp after the stitches have come out. We just took them out, and as you can see, we've got his hair taped up with a little bit of paper tape. Here is the little stitched, or actually the wound here that goes all the way across. You can see there's no stitches in here anymore. It's slightly red. That redness is going to kind of go away over the next couple of weeks. But you can see really the wound has healed. It's just a tiny little line through the scalp that goes across the grain of the growth of the hair. The hair's all coming down like this. And so one of the nice things with the FUT wound and the resultant tiny scar is that it does go across the grain, sorry about that, Dan, of the hair. And what that means is because the hair is coming in an up, from the top down, and the scar is going across perpendicular to the growth, that when you just comb the hair down, it covers it very nicely. And really, you'd have to comb up through the hair, looking for that little wound and soon to be little tiny thin scar. It's not going to suddenly become exposed if you get wet, caught in the rain, or if you're coming out of the pool or the lake, a hot tub maybe. It's just, you kind of have to really make a point of trying to find it. And a lot of people report, because we use the trichophytic method, and it's a surgical method, forcing the hairs to grow through the scar. A lot of times the scar, after it's fully healed, is kind of hard to find, even for hairstylists. And let's take a look at where the grafts were placed in what's called the recipient area. We're going to have a look. Of course, we placed a whole bunch of follicles in through here. You can see the scabbing and redness is all gone. It looks great. You can feel a little bit of peach fuzz there throughout the treated area. And those are going to continue to grow over the next 12 months. And Dan will have his final results at about a year.